皆さん、こんにちは。でみです。私は今、訪問看護師をして4年目になります。看護師の仕事は8年やっています。その傍ら、最近 YouTube を始めました。皆さんに訪問看護や看護師のことをもっと知ってもらいたいなと思い、いろいろ発信をしています。今回は、看護師のいろんな働き方を知ろうという企画の第2回目です。この企画はいろいろな場所、専門分野で働く現役の看護師さんに直接インタビューをしながら看護師のキャリアについて紹介をしていく企画です。皆さんの中でも看護師のこういう分野に興味があるとか知りたいなっていうのがあればコメント欄に書いて教えてください。第2回目となる今日はニュージーランドで働く看護師さんについてです。彼女はニュージーランドの公立の病院で整形外科の病棟で働いている看護師さんです。名前はモニカ。看護師さんって世界中にいると思うんですけど、国が違えば働き方とか考えていることとか違うのかなっていう素朴な疑問があったので、今回インタビューをしてみました。それでは行ってみましょう。Thank you, Monzi, for making time for this interview. I really appreciate it.
Thanks for having me.
Thank you. And can you please tell us about yourself?
So my name's Monica. I'm 25 and I'm a nurse here in New Zealand. I'm half German and half Zimbabwean, and I moved to New Zealand when I was about 7.
Okay. What paper are you studying?
Biological science for practice, biomedical. Everything's online, so we have like one lecture per week. But it's actually a lot harder than all my other papers that I did when I was at uni. I'm reviewing like randomized control trials and pretty much discussing them. This one here that I just did, handed in on Sunday last week, was worth 40%.
Okay.
I have to complete my postgrad certificate within 2 years of me starting. It's hard when you've got like night shift and stuff because your first day off, you literally spend it sleeping, but that's considered your day off.
Yeah, I know. Now you are working at orthopedics ward,
yes.
And
I just reached my 2-year mark last week Friday. So I've been working on the orthopedic ward for 2 years now.
Okay. Congratulations, Monty.
Thank you. It's gone so quickly.
Oh, yeah.
Yeah.
But, so can you tell us what types of injuries many of your patients have?
So like working on like an orthopedic ward, we get like pre and post surgical patients.
Yes.
So like I'm exposed to patients with fractures, dislocations. We get patients that come in from having car accidents, motorbike accidents, any sporting or sporting injuries and things like that. So we see like a lot of we see a lot of elderly patients coming into the ward because for fractures such as like neck or femur fractures, bone infections where patients need like IV antibiotics as well.
Okay.
And lots of like spinal disorders as well. Yeah.
Oh, okay. Okay. Yeah. I never worked at orthopedics ward, but according to Japanese Orthopedics Association, so the challenges they are facing is that like osteoarthritis, elderly people. Is that also similar?
Yep. Yeah. So we get a lot of a lot of patients coming in with severe osteoarthritis, like to their hip or their knee.
Yeah.
So that's why we see like a lot of elective patients coming in for like total knee joint replacements and stuff like that.
Okay. Okay. Oh, that sounds a little bit similar here.
Yeah.
So you said that you're working morning shift tomorrow, but how is your shift like?
So normally like we have a roster, so it's a roster, so everyone kind of needs to have a little bit of both. So you've got the AM shift, which is a morning shift that starts from about 7 in the morning until about 3:30.
Okay.
And you'll have about 4 patients that you'll look after on that shift.
Oh,
Same as the afternoon shift, you'll it'll start at about 2:30. And it'll finish at about 10:30, 11. at night. So you also look after about 4 patients. And then on a night shift, you'll have 9 to 10 patients because there's only 3 nurses overnight. It starts at about 10:30 and finishes at about 7:15, 7:30 the next day.
Okay. Yeah, that's interesting because here in Japan, right, usually you look after 7 patients during the day.
Oh, wow.
And then much more at nighttime. Interesting. Hey,
very different. Yeah.
So how do you find working as a nurse in New Zealand?
I've only ever worked in an orthopedic ward, so that's all I know so far. But from what I've seen, there's lots of kind of benefits or positives to it because within orthopedics is patients are learning to mobilize again. So you're working as a team. There's a lot of teamwork. So I enjoy being able to work as a team with others. I don't know how I would feel if I was to work alone.
Yeah.
You know? But yeah, it's very rewarding. It's a very, very rewarding job. But it's taught me a lot. It's taught me a lot, as in it's taught me how to manage my time a lot more.
Yeah.
I wasn't so good at earlier, like before starting nursing, and then it's kind of taught me a lot more life skills.
Okay, good. So you enjoy working as a team?
We have such a good team of nurses that I work with. Everybody's amazing. But then we also work closely with like physio because we're trying to get patients mobilizing again. Occupational therapists. We've got the social worker as well. And then sometimes we have like speech language therapists and things like that, just depending on what the patients come in with, whether they've got difficulty swallowing and things like that as well.
Oh, okay. So do you have anything you dislike about nursing?
Maybe night shift. I'm not a fan of night shift. I would say night shift. I'm not a fan. But no, it is a really, really like a rewarding job. Although you have days which will be challenging, but that comes with any job. You'll have good and bad days anyway. And I think it depends on who is around you as well and whether the team is
that's totally
That can also
Wow, it's good to have like good team members.
Yeah, definitely. Yeah.
So how many times do you have night shift in a month?
2 to 4, but majority of us do 4. But they'll do at least like 2 days of night shift in 2 weeks, and then another 2 in another 2 weeks.
Wow, that sounds like much less than I expected. Actually, I feel like just working as a nurse in a hospital, the pay is not that great.
Yeah, that's a nurse specialist, definitely. That's why I think it's so important to continue on with your studies in order to become something to go further within the career. That'll help with like the pay and things like that. But
I'm glad that you are enjoying your career so far.
Yes, no, it is good. Yeah, it's only just the start of my career, but I'm loving it so far.
Okay, that's cool. And so, do you have any plans for your future career?
Nursing can take you anywhere in the world, pretty much. But my main plan is just to focus on my postgrad certificate and then see how I go. I could,
Okay.
I could do my diploma next. That can help me if I was to actually consider wanting to be a charge nurse, a nurse educator, or a nurse specialist. So I just want to gain as much experience as I can first, and then I'll decide.
That's cool, Monzi. And so, are you interested in working in different fields or like different specialties?
So I think that's important. Definitely working in different specialties is very important. Only because I'm very limited right now. I only see orthopedic patients, so I only am exposed to patients come in with fractures and dislocations and stuff. So there's certain assessments I don't do anymore. You forget certain things. So I think working for about 2 years in different fields just gives you a little bit more exposure to different things, and also just expands your nursing knowledge as well. So I definitely would would want to move into a different field within the next maybe year or so.
Okay.
Yeah.
That's cool. Thank you, Monzi, for your time, and I really enjoyed the conversation.
That's okay.
I hope you did too.
Yes, no, I did. It was good.
And is there anything else you wanted to talk about, or is there anything you missed out?
No, I definitely think we touched on most of it. Yeah. That's okay. Thank you so much for having me.
Okay, thank you, Monzi. And we shall keep in touch.
Yes, definitely. Yes, I will. Definitely. Okay, that'll be good. Thank you so much.
Thank you. See you, Monzi. Thank you so much. Have a good evening.
Okay, thank you.